Hey, Sandy. So this is Sandy Alfaro. She is a pediatric nurse at Texas Children, and you've been a nurse for like 11 years now, right?
Yes, 11 years.
And how long have you been at Texas Children?
6 years at Texas Children's, and then 5 at Memorial City, where I worked with adults, then NICU, then peds, and then now peds forever.
Yeah, I mean, it's such a cool calling. Um, but so we're having this conversation, and this week we're in these COVID conversations. We're looking at healthcare professionals, healthcare workers, and I really wanted to sit down with you and talk to you specifically about nursing and the nurses and how this is affecting you guys, because I think there's a unique impact on you as a nurse and nurses in general. And so, give me a little bit of an idea of like how have things changed? I mean, I know that you said you haven't had a lot of COVID patients in your area, but you've had secondary things starting to happen. What has your experience been?
So we started off this COVID pandemic by being screened as we come into work. So we get our temperature taken, we get asked questions. We now have to wear masks and goggles into every patient's room. We'll clean the goggles in between rooms. You only get one mask per day, but we cheat. If it gets wet, we'll get another mask. We also have had many patients come in and have a lot of anxiety. We're seeing depression a lot in some of our kids. We're seeing a higher rate of suicide attempts within the pediatric population, as well as child abuse within the pediatric population. So we have multiple CPS cases right now at the hospital. We're also seeing a lot of parents with anxiety and depression as well. We have a visitor restriction at the Texas Children's, at all 3 Texas Children's locations. For a while, we only allowed one parent at the bedside or one caregiver. And then finally, about 2 weeks ago, we started to allow 2 parents, but they had to come in every other day. They can't be in there together. We are seeing more kids come in with more COVID at this time as we're starting to reopen, but what we're also seeing is the secondary effects of COVID in kids, which is the inflammatory syndrome that is going on. It looks like a rash that starts on the legs, goes up to the trunk of the stomach, sometimes on the hands. They're big, red, splotchy areas, and they can cause some heart issues as well as pulmonary issues. These kids are usually critical, but eventually turn around given the correct treatments. We are also seeing a lot of nurses and healthcare professionals in general have extra anxiety, extra stressors, not only for what's going on inside of the hospital, but also outside of the hospital. And we have meetings, so many meetings every day, where we talk about COVID, we talk about the pandemic. Some of these meetings are starting to become a little bit more of a time to just kind of talk about what we're experiencing at the bedside as nurses, and sometimes what we experience outside of the hospital.
Yeah, I think what's fascinating is like when we were talking earlier. I mean, nobody has experience with a pandemic. Like we don't. This is new to us, and so everything changes from day to day. And you've trained and you've been a nurse for 11 years, and now all of a sudden, a lot of what you have known as protocol and the way you do things changed, and it keeps changing. So your guys are doing a certain protocol, and then you have a meeting, and the next day it changes, and there's almost a inability to fall into rhythms that used to have. And I think the other thing specifically for nurses is the majority of the time that a patient will have contact with somebody in a hospital, it'll be as a nurse. The majority of their contact will come from a nurse, because physicians or technicians are in and out, but the nurses are bedside. And so you guys are on the front lines of being in the patient's room, and now all of a sudden it's masks, it's goggles, it's everything else. How is that starting to affect, I think, you guys as a nurse? Like, the emotions of it are one thing, but also you are having to change your life. I know you particularly, you moved from your house to be in to mitigate the risk for other people around you as well. How do you navigate that?
Oh gosh. Um, so every healthcare professional is dealing with this differently. I will say the constant is stress and anxiety. They're just the constant thing. Um, as we get new information, we kind of just go with the flow. At this point, the new normal is go with the flow. Um, there's no real rhythm that we can find because as we encounter new things, as this pandemic progresses, as we begin to reopen, we'll have more obstacles, more challenges to face. So I know once the end of the summer comes, for some people, you might think this is done. It's not done for the hospital. This is just probably going to keep going until we find the vaccine and probably until every single healthcare worker is vaccinated. Will we stop wearing personal protective equipment as we go into each patient's rooms? For myself, I had to, at the beginning of this, move with my sister, who's also a nurse. And we stayed together in her home. And dependent upon which patients we saw, if we saw anyone with positive COVID, we would not see our families. If we didn't, then we would get to see our families. Not till mid-April did we actually decide to switch back. So I'm now at my mom's, but it was a discussion, like, is everyone okay with Sandy being back home? And
Which is, I mean, that's crazy ostracizing. It feeds into the loneliness of all of this.
it does. It's isolating. It just kind of ostracizes you in a way because, you're not intentionally trying to bring something to your families, but that's always in the back of, I think, most healthcare professionals. It's just in the back of their mind, like, am I going to bring this home to my family? The biggest fear would be, am I going to get this, not have symptoms, and pass it on from patient to patient? That is a huge risk and has happened,
Yeah.
and it is absolutely mortifying when it does. It's just like like a sweet nurse's nightmare. But we definitely have seen a lot of nurses quarantining themselves from their families, still continuing to quarantining themselves from their families at this point. My family, it was a discussion for me to come in. It was a discussion for me to interact with other people as well. I wanted to make sure that they felt safe with me being around. But for some families and some nurses and some healthcare professionals, they're still not okay with it. They have elderly people in their families, they have very young children. So we have nurses who haven't seen their kids really since March. And that's very difficult for them. It is very difficult for, I think, not just for their families, but you start to see it at work as well. It's hard to come in and take care of other people's children and you have no idea how your kids are doing except for like Zoom calls. So it's very difficult. I also see that some healthcare professionals are, not as strict with themselves and they're very lax. And that's a whole other side of the spectrum. And they feel fine doing so. But most of us do not feel fine doing that, going out in public and being lax. So at this point, that's kind of a small picture of what's going on.
And it's this balance because, I mean, there's so much, like you had said earlier, there's some nurses that are saying, hey, I just can't sign up for this right now. And they're choosing to sort of like not participate or to in some ways self-quarantine for longer, even if it means no pay, which then economically affects the family as well. And it seems in some ways it's a very difficult balance because what you do is so good, and you guys you do this as a calling. This is the calling that you are following to do this, to care for others, to give your life for others in this way. But at the same time, it's coming at a higher price than it ever has before on mental health, and even just on the strains relationally and familiarly. It's a big change for you guys out of nowhere.
It is. And I think we talked about this before. People keep saying, you guys are on the front lines. It's like, gives this idea that you're like a soldier. These are not soldiers. These are mothers, daughters, sisters. These are fathers, brothers. They are not trained to do this in this capacity, in the sense of being so isolated. But they're doing it. And sometimes it's hard work, and sometimes it's not. Sometimes it's really fun. As a PD nurse, I love playing around with my patients. Like, we'll watch movies together. I have seen Frozen 2 so many times.
So many times.
Yeah. But it's one of those things where you find joy where you can find it, but because of the constant flux of change, what ends up happening is that stress is that underlying current. It's the constant at this point in time.
And like we were talking, and so some people are like, well, like there's all this stress, but the hospitals didn't get overwhelmed. So why did we stay home at all? I loved your take on that. Tell me, like why did we stay home?
So the quarantining occurred because we were trying to keep our hospital systems and infrastructures that we have from being overwhelmed by the amount of patients that could come in with positive COVID or positive COVID patients. We were trying to keep our hospital systems from being overwhelmed, and it worked. So
Yeah.
we have room for people who are coming in who are positive with COVID and other cases as well. And so this is really good, as opposed to like New York. They didn't start their quarantining till much later, and their hospital systems were completely overwhelmed. This is why there were mass graves being, dug out outside of hospitals, or why you saw, very young people passing away because they didn't have ventilators in place. And so we wanted to prevent that from happening. And so in that case, quarantine worked. Like, we are able to accept the new influx of patients that are coming in as we reopen our city.
And I think that's one of the things. I mean, as you're working in the hospital, and the amount of stress that is increased for nurses and doctors and technicians and hospital workers, and it's increased tenfold, 24, 100-fold from what it was prior to this. Adding on an overwhelmed system where you can't care for people, it becomes sort of an impossible situation.
It does. I mean, we were talking about one of my friends who's a travel nurse who just came back from New York, and she told us, this is just what's happening in New York. It feels like you're failing. And just to hear that from a nurse, like, it feels like you're failing every day. I was just like, oh my gosh, I really don't want that for our city, and I'm so sad that it's happening in other parts of our country.
So I love the find joy where you can find it. I mean, that's like, it's such a great kingdom way of looking at this. Like, okay, where can I find joy today, and where can I share it? And we all know, like, I think all of us know someone who knows a nurse. And so my question is this: like, we are overwhelmed by what we're seeing on social media, and this has been politicized to a point, like, on, whether it's masks or not masks, or open or close, or economy or health, or everything has been sort of, it feels like there's very little middle ground where we can just sort of have a conversation without it being pulled to extremes. And so you're coming back from a stressful day of work, and like, social media is not the place you're going to find any sort of consolation, or, my question is, what if we have nurses, doctors, medical professionals, hospital workers in our lives, what's helpful to say and what's helpful not to say? Like, how do we be a blessing to the people that are, like, you guys are living through we're all living through stresses, but you guys are living through some unique stresses that could have never been imagined, 6 months ago. What is helpful to say, and what is not helpful to say?
Well, I think it's very helpful to just reach out and ask, how are you doing? There have been a couple of people who have done that for me, and I really appreciate it every time. Sometimes they kind of get what I call verbal vomit on them, because I just spew out all the things that have made me anxious or stressed throughout the day. But just reaching out, saying hello, I'm thinking about you. But also, specifically, if you know someone who is working in healthcare, not just reaching out and saying, hey, how are you, but allowing them to just speak. Even if they don't have anything constructive to say, just let them spew out whatever it is they need to say, because we don't get to do that. We don't get to do that with our parents, like the parents of our patients, if you're a PD nurse, or family members of your patients. You don't get to do that. You don't get to do that with your patients. You can kind of do that with your other nurses, but that just kind of adds to their stress as well. Because what I've noticed is I was becoming like a sponge as people were telling me their anxieties and stressors. I was just soaking it in. So I needed.
You're like, oh, I didn't even think of that one. And now.
I was like, I didn't think about washing my vegetables with bleach. What? No. Anyways,
yeah.
It's just those things that I'm like, I didn't think about that. But just allowing a space for them to speak. And if they don't have a lot to say, just kind of sitting on the phone with them and telling them, just praying for them. That's it.
So being present, like, and because I mean, you're putting in 12-hour shifts. I mean, this is a, you know, it is a lot to take in all at once, and it's a lot to process afterwards.
It is quite a bit. So there are particular people in my life that I will go into further details about what happened during the day. But to get that phone call from a friend you haven't seen in a while, particularly in this time of like not getting to see a lot of people, while others, because we're starting to reopen, right? So more people are starting to social distance, hang out kind of thing. And there are times where some people do not want to social distance hang out with a healthcare professional because they don't want to run the risk of being exposed to anything. So just even if it's a quick, hey, how are you? It is received, it is a gift, it is good to hear from people who are kind of outside of healthcare as well, because we see each other all the time. So
yeah,
it's nice to hear from people who are not in the hospital with you.
And then, like, if we are gonna, so like reaching out, being present is huge. But if we are gonna pray, like say, like I'm gonna pray for, what would be some really good specific prayers that we could be praying?
Protection. None of us want to get sick. None of us want to expose our families to this illness or any illness. And none of us want to expose our patients to this illness. That is probably the scariest thing, is the idea of exposing our patients to it. So just protection, that our health would stay up, and also that our stress level would find some sort of release, not just through food, because food is a real comfort, but no, we gotta find another one.
Isn't everybody baking now that COVID hit?
Yeah, so we show each other support by bringing baked goods. We will, have pizza parties. We eat a lot. Nurses tend to want to eat anyways because it's stressful. The job is stressful in and of itself, but with these added stressors from COVID and the pandemic, we just were eating like we've never eaten before. So just to find a way to release that stress in a healthy way. And actually, I didn't mention this before, but I started listening to these meditations. They're called Christian meditations, and they're on YouTube. And I listen to them on my way to work, and it really helps me focus on like what is kingdom and what is God before entering into a very stressful situation.
Yeah. Well, listen, like I really thank you for your time, because this is really helpful. And again, that comment of like finding joy where you can find it, I think it's a beautiful sort of goal for all of us in this season. And we thank you for what you're doing, because I know that not only is this crazy stressful, but it's in the middle of what is an awesome, super joyful time. Is you're getting married. Like,
yeah.
right? Yeah, Raul, he's awesome, and you guys are great, and we're so excited about that. But like, we bless you. Thank you so much for this. You're a blessing to our community, and yeah, thank you.
Thank you.